Welcome to Kairos. To successfully self-manage your problem with Kairos and to obtain the best possible recovery, you will always have to cooperate, the best you can, with the following requirements. First, do your sessions. Second, avoid the not recommended activities. Third, in case of a setback, modify your sessions. Almost everyone can meet these requirements. The correct attitude is to incorporate them as habits of your new healthy lifestyle. In doing so, you will become a Kairos satisfied and expert patient. In general, the worse you feel, the more you will have to cooperate. The more you cooperate, the quicker and better you will recover. At the end of this presentation, we will show you practical examples of real patients so you can better understand and implement the information we give you. First self-management requirement: do your sessions. The first requirement to self-manage your problem as an expert is to always do your sessions using the Kairos device. We will teach you in detail how to do it in the videos designed for that. For now, understand that your sessions are as important as if you had to take regular medication to cope with a disease. They are programmed with a logic necessary for your recovery. The best time of the day to do your session will be before you go to bed. This way, your body will rest the following hours, and the effects of the device on your body will be enhanced. If you don't usually have a good night's sleep, if you are restless or have nightmares, it is better that you do your session about 2 hours before going to bed. Please, understand that this program is not based on applying the Kairos device whenever and however you want or whenever you feel bad. Only a few situations may require to modify or reschedule your sessions, and we'll cover these situations during this presentation and in the next videos. When starting your self-management, your sessions will be more intensive. Make sure that your agenda and lifestyle allow you to do your sessions without interruption. Otherwise, wait a few days until your agenda is more clear. Self-management continues after the initial months. All of your sessions are of equal importance for the chronic self-management of your problem. Never forget to do them. Second self-management requirement: avoid the not recommended activities. The second requirement to self-manage your problem as an expert is to always avoid, the best you can, the not recommended activities. Suffering rigid body means that your body is not as strong as it should be. It is delicate, especially during the first months of starting your self-management, as if you suffered any other injury or disease that required rest time to heal. That's why we require you to avoid certain activities that could cause you to have a setback, that is, to feel worse than normal. And neither you nor we want that to happen. So make sure your agenda and lifestyle, especially in the first 4 to 8 weeks of your self-management, are as calm as possible. Depending on what type of patient you are and on your lifestyle, these activities may affect you differently. Sometimes, you'll have to do them because there's no other option. In that case, do them with caution and try to get help. If you're used to doing any of these activities because of your job, they may not affect you as negatively, although the more you can avoid them, the better. Some activities may be performed unconsciously, giving you an unavoidable setback. Remember that your recovery occurs thanks to doing your sessions with the Kairos device, and avoiding these activities is a requirement for the best recovery. The activities to always avoid are the following: walking a dog that pulls the leash strongly, risky driving, motocross, 4x4, hard sudden braking, driving over bumpy roads, amusement parks, bumper cars, roller coaster, cracking your neck, holding your head upwards in an extended position, hairdressing salon, dentist, washing your hair, working with your arms above your head or at head level, turning your torso to pick up something without turning your hips, holding the phone with your shoulder or with your arm raised for an extended period. In these cases, it's better you use a phone headset. Texting, playing video games, reading, using laptop with your head looking down. In these cases, place the device at head level. Sudden neck turns, keeping your head turned while speaking to people. Using complements such as other physical treatments or devices on your body. Using spa water jets or a pressure shower too close to your body and neck. Lying facing down. Having your mouth extended open for a long time, such as with tooth extraction or dental cleaning. Repeated coughing and sneezing, vomiting. Yawning and stretching strongly, especially when getting out of bed. Wearing tight clothing or high heels for long periods. Sitting with wallet in a back pocket. Strong hugging or strong handshakes. Restless sleeping, nightmares, tossing and turning while lying in bed. Unrestrained sexual activity, forced sexual positions, excessive masturbation. Next, we'll show you the activities to avoid during the first 4 weeks of starting your management. Hiking, camping, family picnics, sightseeing tours, partying, dancing, heavy drinking, shopping, long trips, do-it-yourself projects, handcrafting, sewing, manual works, gardening, tidying and cleaning the house, clothes or closets, washing, ironing, hanging clothes or curtains, packing, unpacking luggage, window cleaning, vacuuming, scrubbing, sweeping, making the bed, horse riding, mountain biking, carrying heavy shopping bags and purses, moving, carrying, lifting furniture and other weights, carrying or playing with kids, especially in bent postures, neck and body stretching, standing up for more than 30 minutes. In these cases, every 30 minutes try to sit down and rest for 5 minutes. Practicing sports. Artistic activities, playing musical instruments, decorating, painting, or others. Ergonomics. We recommend doing daily life activities with the correct body posture to prevent setbacks and to avoid pain and discomfort related to bad posture. Standing. Keep your back and head straight with your shoulders backward, natural, and relaxed. Avoid bent postures as much as possible. Sitting. Keep your buttocks in the back of the chair and your back relaxed, leaning on the back support with head and back straight. Legs should be parallel and feet on floor or foot support. Avoid sitting with the buttocks in the front of the chair and not using the back support. Avoid chairs without back supports. Avoid crossing your legs one over the other, and avoid looking down or tilting your head to the sides. Desk. Use a high-quality chair with head, back, and elbow support if possible. Place feet on a support. Use an ergonomic mouse and keyboard at a comfortable distance from arms and hands. The computer screen should be at eye level, at the correct distance. Keep your head straight. Use a hands-free phone. Use a book holder to read books, magazines, or newspapers. Couch. The best type of resting couch is a recliner with a firm seat and back support in which you can sleep correctly if needed. If using other types of couches, sit as if you were in a regular chair, avoiding bad posture. Avoid falling asleep with your neck turned, forward, backward, or tilted. Bed. Use a firm, quality mattress. Special neck pillows do not always work for everyone. Choose a pillow that suits you best. It should not be too high if you lie on your back. If you lie on your side, your head should be supported to be neutral with your back. The best way to sleep is to face up or on your side. Avoid sleeping on your stomach. In the case of having to sleep seated, use a cervical travel pillow. If you must sleep in a bed other than yours, it is best to take your home pillow with you. Avoid eating, reading, using a tablet or mobile phone, and watching TV in bed, unless you're placed in a correct posture to do it. When arising from bed, do it slowly. First move to your side, then sit, and finally stand up. Carrying weights. Get used to asking for help if you need to move or lift heavy objects. Use a shopping cart for groceries and invest in a domestic trolley if you must carry them any distance. Use a suitcase with wheels instead of hanging bags. If you must use a backpack, keep it in contact with your back and use both straps. Don't load purses or other bags too heavily, especially if you must carry them for long distances. At this point, you may think avoiding these activities is too restrictive for you, or maybe not. If you feel comfortable avoiding these activities, great. If you do not, because a certain activity forms part of your lifestyle, then you will have to decide to keep doing it, wait a while before doing it again, or quit doing it. Do not think that because you may have to do any of the not recommended activities, you can't become a Kairos patient. Kairos is designed to deal with these types of situations, so you can recover as well. If you are in doubt as to how an activity may affect your particular case, ask the Kairos support team. Third self-management requirement. In the case of a setback, modify your sessions. The third requirement to self-manage your problem as an expert is to modify your sessions in the case of a setback. As an expert patient, you must understand that managing your problem with Kairos will be a path with ups and downs. Sometimes you will feel very well, but other times you may not feel as well as you would like. This is normal. What's a setback? We define a setback as a period of time when you may feel worse than normal due to your normal body shifting to rigid body. That could happen after days, weeks, months, or years of using Kairos. This is not a reason for alarm, despair, mistrust, or frustration. It is a reason to understand what has happened, what to do, and to continue with Kairos. We distinguish two types of setbacks. The natural setback. The natural setback mostly occurs during the first 2 to 6 months of the first year of your management. In general, the worse your health is, the most probabilities you have to experience the natural setback. You may feel and think like this: I'm not as well as I'd like. I feel like battered. I feel bad. I feel worse than normal. I feel more tired than normal. Or, my muscles are sore as if I had practiced sport. These sensations are normal and are due to your body changing from rigid to normal and vice versa, and due to the self-healing process that is being carried on within your body. The accidental setback. The accidental setback can happen in these situations. If you suffer a new injury, a fall, a blow, or any other accident affecting your physical body. If you do not cooperate with the 3 self-management requirements. If you undergo some type of physical treatment counterproductive to your management. If your lifestyle affects your recovery. These 4 situations could make your problem and your pains worse. You could even feel new and sudden pains of different intensity in areas of your body where you had not experienced before. You could feel the following ways: I feel bad. I feel awful. I feel worse than normal. I never had these pains before. Or I'm stuck. I can't move. Don't be afraid if that happens to you. It is a possibility, and we like to inform you about it. Remember also that our program is designed for you to recover in the best manner and quickest time possible if you suffer an accidental setback. If you experience either a natural or an accidental setback, as an expert patient, you will have to manage your setback by cooperating in the following way. Be patient. Rest. Endure the pain. Take your pain medication if you need to. Contact the Kairos support team. You will most probably have to reschedule your sessions if you suffer an accidental setback. The Kairos support team will explain to you in more detail when and how to add more sessions to your program if needed. There is nothing else to do in the case of a setback regardless of how bad you feel. This is the same as a specialist would do if you attended a clinic to manage your problem. We can't do anything else, and we believe it is better to do nothing than to do something that could make your problem worse while trying to alleviate your pain. If you do not cooperate in managing your setbacks, you can alter your sessions drastically, delay your recovery, or even abandon Kairos. This incorrect attitude should be avoided. Conclusion. As you've seen, the 3 self-management requirements are quite easy to cooperate with, but you'll have to adopt them for the best recovery. Let's summarize them with examples. Before starting your self-management. When Erica decided to start her Kairos program, she was busy with work and family matters, so she decided to wait 2 weeks before starting her self-management, when her agenda was more relaxed. This is the correct attitude. Before James started his Kairos program, he preferred to complete some unfinished work, gardening and cleaning the house for a few days. After he completed that work, James started self-managing his problem. This is the correct attitude. When starting his Kairos program, Mark decided to stop his regular exercise in the gym during the first weeks of starting his self-management, knowing that later on, when his body is stronger, he'll be able to do it again. This is the correct attitude. During your self-management, Daniel is a painter. He can't stop working. This includes doing one of the not recommended activities, working with his arms above his head. Daniel started his Kairos program with caution, not overdoing it as work, especially during the first 4 weeks. He also told the support team about it, so his sessions were programmed accordingly. This is the correct attitude. Sabrina started her management, and she made sure that during the first 4 to 8 weeks of managing with Kairos, her number 1 priority was to do all her sessions without interruptions. She kept her agenda clear to make sure she didn't overdo and had the time to rest after sessions. This is the correct attitude. Rose determined during the first 4 to 8 weeks of starting her management with Kairos to do the least amount or none of the home duties, such as cleaning, ironing, or shopping. If she had to do any of these, she did it carefully, a few hours before doing her session, and for less than 30 minutes at one time. This is the correct attitude. 7 months after starting her management, Delora feels pretty well. However, she doesn't take it for granted, and she keeps doing her sessions and paying attention to the not recommended activities without overdoing them. This is the correct attitude. Tony started his management, and after 6 months, he was feeling much better until he suddenly had a setback during his holidays and felt bad again. He understood what had happened, took it calmly, and he followed our advice. He recovered after some time and feels better again. This is the correct attitude. Vanessa understood that practicing some type of sport was counterproductive for her management. It caused her discomfort in her back. She decided to do a lighter type of exercise, which benefited her the same and didn't cause her discomfort. This is the correct attitude. Roger felt all kind of change in his body and even some pain and discomfort during the first months of self-management. He understood that was a natural setback and how to manage it. He endured the pain and kept doing his sessions. After a few months, he stopped feeling those changes related to the natural setback and the self-healing process of his body that was taking place at the beginning of his management. This is the correct attitude. Michael, after 2 years of self-management, when he was feeling very well, experienced an accident at work and felt bad again. He understood how to manage his accidental setback. He followed our advice, recovered, and felt well again. This is the correct attitude. Peter is 84 years old. He understands that he can't expect to feel as well as he would if he were much younger. He accepts this fact and keeps cooperating with Kairos to have the best possible recovery according to his overall health. This is the correct attitude. During this presentation, we showed you the 3 self-management requirements that can generally be applied to all patients. But depending on your overall health and lifestyle, you may have individual needs. You may also have questions about your particular case. Here at Kairos, we deal with the needs of patients whose health is slightly to severely affected, moderate, typical, and borderline patients. We also deal with patients with all types of lifestyles: athletes, hard workers, businessmen and women, young people, and older people. Regardless of the type of patient you are and your lifestyle, and considering the 3 self-management requirements, the Kairos support team will guide you, customizing your program to your particular needs and your overall health for your best recovery. Your cooperation will be required, complying with the 3 self-management requirements.